If you are over 60 and you find yourself waking up at 3 in the morning, night after night, staring at the ceiling and wondering why your body won't let you sleep, this video is going to give you answers that most people in your situation never receive. And here is the most important thing to understand before we go any further. This is not just about sleep. Waking up consistently at 3 in the morning after the age of 60 is one of the ways your body communicates that something deeper is happening, and dismissing it as simply getting older or having a light sleep is one of the most common and costly mistakes people make. Stay with us until the very end, because the final reason we cover is the one that surprises people the most, and it might be the most important signal of all. Let's start by understanding why 3 in the morning specifically. Why not 2, or 4, or 5? The answer has everything to do with the architecture of sleep itself and how it changes significantly after the age of 60. Human sleep is not a single continuous state. It moves through cycles throughout the night, each cycle lasting roughly 90 minutes and containing different stages of light sleep, deep sleep, and the dream stage known as REM sleep. In younger adults, deep sleep dominates the first half of the night, and the later cycles contain more REM sleep and lighter stages. But after 60, the proportion of deep sleep decreases substantially, and the body spends more time in lighter sleep stages. 3 in the morning falls right at the boundary of these cycle transitions, the point in the night where the body is most likely to shift from deeper to lighter sleep, and where any internal or external disturbance is most likely to wake someone up. This is why 3 in the morning is such a consistently reported waking time for people over 60. It is not random. It is tied to the changing architecture of aging sleep. But the timing alone doesn't explain why it keeps happening, or why so many people find it impossible to fall back asleep once they wake at this hour. For that, we need to look at what is actually happening inside the body during those early morning hours, and this is where the picture becomes genuinely important. The first reason is the natural cortisol cycle, and this is one of the most significant and least understood contributors to 3 in the morning waking in older adults. Cortisol is often called the stress hormone, but it is more accurately described as the alertness and wake-up hormone. In a healthy circadian rhythm, cortisol levels are at their lowest in the early evening, allowing the body to wind down and fall asleep. They then begin a natural rise in the early morning hours, reaching their peak roughly around 8 in the morning to support wakefulness and daytime energy. However, as people age, this cortisol curve can shift earlier, meaning the morning rise in cortisol begins sooner than it should, sometimes as early as 2 or 3 in the morning. When cortisol surges at this hour, it triggers a degree of physiological alertness that pulls the body out of sleep. The person wakes up, often with a racing mind or a feeling of anxious alertness, and finds it very difficult to return to sleep because cortisol is already signaling that the body should be awake. This shift in the cortisol curve is influenced by chronic stress, poor sleep habits accumulated over years, high blood sugar, inflammation, and in some cases thyroid dysfunction, all of which become more common after 60. The second reason is blood sugar fluctuation, and this is one that almost nobody connects to their 3 in the morning waking because it doesn't feel like a blood sugar problem. It feels like simply waking up. Here is what actually happens. After the last meal of the day, blood sugar gradually falls overnight as the body uses glucose for its various maintenance functions. In many people over 60, particularly those with any degree of insulin resistance or prediabetes, which is far more common than most people realize in this age group, blood sugar can drop to a level in the early morning hours that the body interprets as a mild emergency. In response, the body releases adrenaline and cortisol to signal the liver to release stored glucose and raise blood sugar back to a safe level. This hormonal surge is what wakes the person up. They may feel their heart beating faster, feel slightly anxious or unsettled, feel hungry, or feel unable to quiet their mind enough to sleep. None of this feels like a blood sugar event, but that is exactly what it is in many cases. People who eat a small protein-containing snack before bed sometimes find their 3 in the morning waking improves, precisely because the protein slows the overnight drop in blood sugar and prevents the body from triggering this emergency hormonal response. The third reason is declining melatonin production. Melatonin is the hormone that regulates the sleep-wake cycle, signaling to the body when it is time to sleep and when it is time to wake. After 60, the pineal gland, which produces melatonin, naturally produces significantly less of it than it did in younger years. This decline in melatonin doesn't just make it harder to fall asleep initially, it also makes sleep shallower and less continuous throughout the night. Less melatonin means the body has a weaker signal maintaining sleep through the night, which means it is more easily pulled out of sleep at those vulnerable transition points in the sleep cycle. This is compounded by the fact that light exposure, blue light from screens in particular, suppresses melatonin production even further, meaning people who watch television or use phones close to bedtime are actively reducing an already diminishing melatonin supply in a way that directly worsens the 3 in the morning waking pattern. The fourth reason is one that many people have but many haven't been diagnosed with, and that is sleep apnea. Sleep apnea is a condition in which the airway partially or fully collapses during sleep, causing the person to briefly stop breathing and then wake, often without any awareness that this is happening. In younger adults, sleep apnea is more commonly associated with loud snoring and daytime fatigue. But in older adults, particularly women after menopause, sleep apnea can present quite differently, with the primary symptom being frequent nighttime waking rather than obvious snoring. The 3 in the morning waking that many seniors experience is in some cases caused by repeated microarousals from undiagnosed sleep apnea that accumulate through the night until the person reaches full wakefulness in the early morning hours. Sleep apnea in older adults is significantly underdiagnosed, partly because many people, particularly women, don't fit the stereotypical profile of a loud snoring overweight man, and partly because the nighttime waking it causes is so easily dismissed as simply a normal part of aging. If you consistently wake at 3 in the morning, feel tired despite adequate time in bed, or have been told you snore or gasp during sleep, discussing a sleep study with your doctor is genuinely worth considering. The fifth reason involves the bladder and kidney function, which change meaningfully with age in ways that directly affect sleep. The kidneys produce more urine during the day and less at night in younger adults, following a hormonal pattern regulated by a compound called antidiuretic hormone. As people age, this pattern can shift, and the kidneys may produce more urine during the nighttime hours than they did in younger years, a condition doctors call nocturia. Additionally, the bladder itself loses some of its capacity and flexibility with age, meaning it signals fullness at lower volumes than it once did. The result is that what would have been a manageable level of bladder fullness in earlier years becomes an urgent enough sensation to pull a person fully awake at 3 in the morning. This is worth distinguishing from blood sugar or cortisol waking because the first sensation upon waking is a clear need to urinate, whereas the other causes tend to produce a more general sense of alertness or unsettled wakefulness without an obvious physical trigger. The sixth reason is body temperature regulation, which becomes less efficient with age. Deep sleep is associated with a drop in core body temperature, and the body actively works to maintain a cooler core during the deep sleep phases of the night. As the night progresses into the early morning hours, the body begins its gradual warming back toward daytime temperature in preparation for waking. In older adults, this temperature regulation is less precise, and the warming cycle can begin earlier and more abruptly, contributing to the experience of waking in the early morning hours feeling warm, restless, or unable to settle back into comfortable sleep. For women who are in perimenopause or postmenopause, hot flashes that occur in the early morning hours compound this significantly, producing sudden intense heat sensations that fully interrupt sleep at exactly the 3 to 4 in the morning window. The seventh reason, and the one that surprises most people, is the connection between 3 in the morning waking and emotional or psychological processing. The REM sleep stages that dominate the later part of the night are the stages during which the brain processes emotional memories, resolves stress, and consolidates experiences from the day. When someone is carrying significant unresolved stress, anxiety, grief, or emotional burden, the brain's processing work during these REM stages can become intense enough to pull the person into wakefulness. This is why people who wake at 3 in the morning so often report lying awake with racing thoughts, worries, or a flood of memories and concerns that seem impossible to quiet. The mind isn't keeping them awake randomly. It is actively working through something it hasn't been able to fully process, and the intensity of that work is what crosses the threshold into wakefulness. This connection between emotional burden and early morning waking is deeply underappreciated, particularly in older adults who may have accumulated decades of stress, loss, and unresolved emotional weight that the nighttime hours bring to the surface. Now let's talk about what you can actually do, because understanding these causes is only valuable when it leads to something practical. Let's also take a moment to talk about something that doesn't get discussed enough in the context of nighttime waking, which is the role that inflammation plays in disrupting sleep architecture in older adults. Chronic low-grade inflammation, which becomes increasingly common after 60 due to factors like a less active immune regulation system, accumulated oxidative stress, poor diet, excess body fat, and years of inadequate sleep itself, directly interferes with the brain's sleep-regulating systems. Inflammatory compounds called cytokines can alter the production of sleep-promoting neurotransmitters and disrupt the hormonal balance that keeps sleep consolidated through the night. This is part of why people who eat diets high in processed foods, refined sugar, and inflammatory fats often sleep so much more poorly than those who eat diets rich in vegetables, whole grains, and anti-inflammatory foods. The inflammation from diet and lifestyle choices reaches the brain and disrupts the very systems responsible for maintaining sleep continuity. For people over 60 who are experiencing consistent early morning waking, taking a serious look at overall diet quality, not just what they eat close to bedtime, is one of the most impactful and least discussed steps they can take. The role of magnesium is also worth mentioning, because deficiency in this mineral is extremely common in people over 60 and has a direct relationship with sleep quality. Magnesium plays a role in regulating the nervous system and supporting the production of GABA, a neurotransmitter that promotes calm and sleep. It also plays a role in regulating cortisol and blood sugar, two of the primary drivers of 3 in the morning waking that we discussed earlier. Many older adults are magnesium deficient without knowing it, partly because magnesium absorption decreases with age, and partly because the modern diet is generally lower in magnesium-rich foods like leafy greens, nuts, seeds, and whole grains than diets of previous generations. Addressing magnesium levels, whether through dietary improvements or supplementation discussed with a doctor, is something that has helped many people over 60 notice a genuine improvement in their ability to stay asleep through the early morning hours. Alcohol is another factor that deserves direct mention, even though many people don't connect it to early morning waking. Alcohol is widely used as a sleep aid by older adults, and it does help with the initial falling asleep. But alcohol significantly disrupts sleep architecture in the second half of the night. As the liver metabolizes alcohol in the early morning hours, it triggers a rebound alertness effect and suppresses REM sleep, which is precisely the sleep stage that dominates the 3 to 5 in the morning window. This means that even a modest amount of alcohol consumed in the evening, which seems to help with falling asleep, is actually one of the most reliable ways to ensure early morning waking around 3 in the morning. Many people who stop drinking alcohol in the evening are surprised to find their 3 in the morning waking improves significantly within just a few nights. The quality of the sleep environment itself is also worth examining carefully. Older adults often have a heightened sensitivity to noise, light, and temperature changes during sleep compared to younger adults, because the lighter sleep architecture of aging makes them more easily disturbed by environmental stimulation. A room that seemed quiet and dark enough for sleep in earlier decades may now have small sources of light or intermittent sounds that are sufficient to cause waking at 3 in the morning during a vulnerable sleep transition. Evaluating the sleep environment with fresh attention, using blackout curtains, addressing noise sources with earplugs or a white noise machine, and ensuring the room temperature stays consistently cool throughout the night, are practical and often underappreciated steps that can meaningfully reduce the frequency of early morning waking. The most important step overall is to stop dismissing 3 in the morning waking as simply getting older. It is not inevitable. It is the result of specific, addressable physiological processes, and identifying which of the reasons we've discussed applies most closely to your situation is the starting point for meaningful improvement. If you suspect blood sugar fluctuation, experimenting with a small protein-rich snack before bed is a reasonable and low-risk step. If you suspect cortisol dysregulation from stress, working on a consistent wind-down routine that begins an hour before sleep, minimizing screen use, and addressing underlying sources of chronic stress will support a healthier cortisol curve over time. If melatonin decline seems relevant, reducing light exposure in the 2 hours before bed and keeping the bedroom as dark as possible during sleep supports whatever natural melatonin production remains. If nocturia is the primary trigger, speaking with a doctor is important because there are both benign explanations and some that warrant investigation, and a doctor can help identify whether any medications you're currently taking are contributing to increased nighttime urination. If body temperature is a factor, keeping the bedroom cool, choosing breathable bedding, and in the case of night sweats or hot flashes, speaking with a doctor about options can all make a meaningful difference. And if emotional burden and racing thoughts are consistently present when you wake at 3 in the morning, addressing that dimension of your experience, whether through counseling, support groups, spiritual practice, journaling, or simply honest conversation with someone you trust, is as medically relevant as any physical intervention. Before we close, it's important to say clearly that while all of the causes we've discussed are well supported by sleep medicine and general medicine research, this video is for general educational awareness only. It is not a diagnosis, and it does not replace an evaluation by your own doctor. If you have been experiencing persistent nighttime waking that is affecting your quality of life, your energy, your mood, or your ability to function during the day, that is a conversation worth having with a healthcare provider who can look at your complete health history and help identify what is most relevant to your specific situation. If this video finally gave you an explanation that makes sense of something you've been experiencing for months or years, please share it with someone over 60 in your life who is dealing with the same thing, because this is information that most people desperately need and almost never receive. If you found this video helpful, please like it and subscribe to Dr. William Hart Health for more videos like this every day.